everybody. My name is Lisa, and like Jared said, I am the team leader for our chronic care management program at Frederick Health Hospital. A little background of myself. I am an RN, and I've been a nurse since 1986. I've done lots of many things: pediatrics, NICU, med surg, home health care, care transitions programs, and things like that. My latest, what I did previously for about 10 years was home health care. I love going in the home. I find that that's where we find all the many answers to all of our many issues with the home, what the patients are eating, how they're taking their medication, how they're taking care of themselves, any issues, transportation, things that they have going on. What I found was that there's a group of people, as everyone who knows home health, but it's very, very regulated. But there's a group of people that don't meet that criteria for to be home health care. They're not hospice appropriate. They're not home health appropriate. So where do those people go? So my vision was to have a program for these people with chronic diseases, heart failure, COPD, hypertension, or people that just need help, and to be able to work with the telemonitoring program to be able to have it for them to be successful at home. One of the main, of course, criteria for that was how that was going to be funded, because back then there was really no reimbursement for any of these things that we were able to bill for. But for me, my whole argument with our hospital system was, let's give this a try for a year until we get our data back, and let's see how we do. And I pretty much was a department of one for the first year because I felt so strongly about this program that we really needed to get involved with. HRS came along the picture because our previous director for home health care met them at a conference, and so she was very excited, and so she introduced me to Jared and to Nolan and to the HRS company. And so, as you can see from this slide, we started out by ordered 75 telehealth units. I was the person pretty much running the whole program. And so we started out with 3 patients, and we chose the patients who at that point had been discharged from home health care. But the nurses and therapists still felt like they needed to have just a little more follow-up after that. So we were able to keep the monitors in the home. We switched them over to our chronic care management program, which we have like a consent form and everything for people for them to sign. And it's a free program. I'm very blessed to be able to work with a hospital organization that's very community and population health focused, and so we were able to offer this to the community free of charge to the patient. And so I kept telling them, if we do this well, we're going to be able to reduce readmissions. We're going to be able to reduce our ER visits. And you can tell by the next part of the slide, 6 months post-launch, we were able to reduce our readmissions by 81%, and also our ER visits 55%. And we were able to save the health system $2.6 million. And how that was figured out was, I have a list of patients that we keep who are on the program, and our data analysts at the hospital took the information that I gave them, and they compared Medicare claims 6 months prior to being part of the program and then 6 months post being on the program, and they were able to compare the cost savings, and that's how they came up with the $2.6 million. So after that year to year and a half, and again, like Jared said in the beginning, it does take patience to ramp up a program. I love the technology. I love the partnership that we have with HRS, but I will tell you another successful part of a CCM program is the personal touch that you have with these patients. These patients are on monitors, and we call them for any abnormalities we might see in their readings, but we also reach out to them every week and call them and make sure that they're doing okay. Call them to make sure that they're doing okay with their medications, getting to the doctors. So it pretty much is the whole package. The telehealth is a way for us to be able to get into the home and have like some concrete like vitals and how they're doing with their weights and things, but it's that personal call that we make every week that makes the biggest difference for these patients, because they learn to trust us. They learn to be able that they can share with us things. That we're dependable. We're going to be able to help them. So a year after we launched the program, the hospital, seeing the money we were able to save on the back end, we were able to purchase more units. We also grew from myself to additional team members, which has just been amazing. So we've gone from a team of 1 and to right now we have a team of 7 that are able to help out with the monitors. So and again on the screen here you can see our 2-year post-launch. We've got over 300 monitors, and our last data that we just did in February showed a 83% reduction in readmissions, 50% in ER visits, and a $5.1 million cost savings for the health system over this time frame, which has been just very, very exciting.